is TMS permanent?
I wish TMS were curative and permanent. Unfortunately, while the benefits can last for months or even years in some people, it's not a permanent fix, at least as we are able to practice it in 2023.
A lot of questions I've been getting recently is the additional rounds better, right? Does the second round last longer? Does the third round last longer?
It's a great question, because patients want to know, like, what to expect for the future.
Mm-hmm.
And one of the things that I think is important is that in some of the early studies, we have this commonly held idea in the field that 30 or 36 treatments is a course of treatment, and really that comes out of some of the early studies that were done, where, pragmatically speaking, it seemed like a 6-week trial was a feasible thing for people to undertake. But there are other studies that suggest that some people who are partway well at the end of 30 treatments will get all the way well if you can just keep going. And so whether the number for a given person is 30 or 50 or 70, there is, as is the case for most things in psychiatry, one size seldom fits all. And yet, there's this idea that there's this standard number, which comes out of the original trials that the FDA was asked to review to give clearance to the devices. But science has moved on since then, and now we have some protocols where if the standard number is 50 treatments, 50. Mm-hmm. And if you do that, you get much higher probabilities of both response and remission, getting all the way well, than you do if you only do 30. So I think there's a lot more to learn about this. One thing that we do know is that if a person has responded well to one course of TMS, they are rather likely to respond well in their next depressive episode to TMS again. It's not a guarantee, but it's certainly it's highly likely that they will continue to do well.
Before I continue, do me a favor, like and subscribe to this channel. It's going to help the YouTube algorithm and help take TMS to the people in need. YouTube, do yourself a favor. Check out this next video right here.
That's the one to look for.